Thanks, Emmy. Just so we get it straight from the beginning, Concern Worldwide,
Yes.
and just a little bit about us. We're a non-governmental organisation headquartered in Ireland. We have Concern UK and Concern US as well as part of the family. We work in 25 countries, mainly in Africa and some in Asia, and also in Haiti. We have a strategic linkage with IFPRI for the last number of years, which we value a great deal. And I have two colleagues here in the audience. One is Anne-Marie Meyer, who's in nutrition advisor in the London office, and the other is Rahul Rawat, who for the past 3 years has been working actually in IFPRI itself, but working on operations research for Concern, and certainly some of the more detailed aspects of this program. They know more about it than I do. Just to put another piece of context, obviously the issue, people talk about 1 billion hungry people in the world. When you break that down, we're talking about severe malnutrition, which accounts for less than 10% of that number, and chronic malnutrition, which accounts for the rest. So chronic malnutrition, with all its manifest costs in terms of human development, etc., is really the big problem. Now, Concern has been very involved in nutrition issues very much for the last 10 years, and we're central to developing the approach which is now called CMAM, Community Management of Acute Malnutrition. And just a little background on that, because it's relevant, I think, to what I'm going to talk about in more detail. Rain. The original idea as to how to tackle severe acute malnutrition came from Steve Collins, of Valid International. And he came to Concern in about 1990, around 2000, around that time, to say, could we test this together? And over a period of 3 years, we began to field test this approach. I mean, most of you, I take it, are relatively familiar with CMAM, to test this approach in a number of countries, which we did. And we accumulated evidence relatively quickly that this was a more efficient way of tackling severe acute malnutrition than what was then the conventional way, dominantly based on therapeutic feeding centres. We showed that death rates were reduced and coverage of population was significantly increased. And we brought that information to an important meeting which was held in October 2003 in Dublin, which the wider nutrition community attended. And as this if you like, technique, we were calling it then community therapeutic care, was taken up by more agencies, more evidence accumulated. And that ultimately it led in April 2007 to the adoption by the main UN agencies of community management of acute malnutrition as, if you like, the preferred way to deal with this problem. And now I think the challenge is to implement it and integrate it into health systems in many countries, and that's still a huge challenge ahead. But that still left the chronic malnutrition, the 90% of the hunger problem dealing with chronic malnutrition. And in discussions with IFPRI, which took place in September 2009, we came together and began to ask, could we design a program which would directly address this issue, based obviously on what the knowledge that was there about what was known about how to deal with this problem, and the knowledge that you really did need an integrated approach, bringing together agriculture, health, and nutrition interventions. And arising out of that meeting, there was an agreement that we would attempt to design a program which would address this directly. We got funding from Irish Aid to support the program design. And so during 2010, basically, we've been working on a program design for this problem. And this is what we now call the RAIN program, the Realigning Agriculture to Improve Nutrition. We also did, within our organization, we went to tested it, well, as we were working through and working out this design, we tested it went to 3 different countries to see which country we would actually implement it in Ethiopia, in Uganda, and Zambia. And we eventually came down on the side of Zambia, and that's where it is now about to be commenced in Zambia. It's going to happen in the district in the central region, Mumbwa, which is an area which currently has 59% childhood stunting. And the core objective of this program is to develop a sustainable implementation model that combines agriculture, nutrition, and health interventions to effectively prevent child stunting and maternal undernutrition among poor rural communities. So that's, if you like, the broad objective. And more specifically, the objective is to reduce the prevalence of chronic malnutrition among young children and improve the nutritional status of pregnant and lactating women through targeted intervention during the critical period from conception to 23 months of age. To realign and integrate activities and mechanisms within the Ministry of Agriculture and Cooperatives and the Ministry of Health, especially at district level, to more effectively and efficiently achieve sustainable nutritional outcomes, and to use and share evidence generated at the district level to influence local, national and international policy agenda to prevent child stunting. So that's, if you like, very much, I think, central to the sort of discussions we've been having here at this meeting. Who's involved in terms of partners? Concern will provide the technical assistance and capacity building and will facilitate the coordination and alignment processes between the key line ministries. And those 2 ministries are the Ministry of Health and Ministry of Agriculture and Cooperatives. There's also a local NGO involved, the Mumbwa Child Development Agency, and another one called Women for Change, who will support the gender-related activities. And IFPRI are very directly involved in all the aspects of monitoring, learning and evaluation which will come from this project. The specific project approach envisages that the project will use the existing evidence base and will improve it where gaps exist through an appropriate project design and ongoing operations research. There'll be an integrated agriculture, nutrition and health and gender interventions adapted locally by communities. It's focused on both government and non-government partners working in an integrated way to ensure sustainability and encourage replication and scale-up. It's targeting mothers and children during this window of opportunity up to 2 years of age for a child to maximise impact and nutritional status. It will place special emphasis on ensuring that extremely poor households will benefit from the project through effectively adapting project services to the needs of the extreme poor, and the empowerment of women will be a cornerstone of the approach and a key outcome of the envisaged system change. Now, somewhat more detailed aspects of the project design, it is looking at this whole issue of intersectoral interventions coordinated by Concern and implemented by the partners overseen by the government ministries. There'll be 2 different sets of project interventions, and the effectiveness, including the cost effectiveness of each set, will be compared to examine the output. And these interventions are agricultural activities only, combined agricultural activities and nutrition and health related activities, and then a control group. Agricultural activities will aim at improving the availability of and access to micronutrient-rich plant and animal source foods at the household level and improving food production techniques. There'll be a nutrition and health component, primarily through a behaviour change communication strategy to optimise food utilisation by improving maternal nutrition, infant and young child feeding, hygiene and healthcare seeking practices, and linkages to routine healthcare services and campaigns. The activities will emphasise gender equality and women's empowerment to support the improvement of women's status and decision making. Other activities will include improving household level food preparation, storage, preservation and preparation techniques, and exploration appropriate time and labour, exploring appropriate time and labour-saving technologies. And together, these elements will improve the availability of high-quality foods at household level, maternal and child nutrition, infant and young child feeding, hygiene and health care seeking practices. And clearly we're going to be using rigorous monitoring and evaluation through all of this. So that in essence is the project. We think it is addressing an absolutely core issue, the core issue of how to directly deal with the issue of stunting, which is such a major problem with such long-term consequences. We're clearly very interested in working closely with government authorities for interests of sustainability, and we'll be very keen, as this project develops, to share any knowledge that emerges from it. We also would like to extend our work, the same approach, to test it in other countries. And that is a matter of funding, and of course, if there are any funders here who would like to help us do that, we would be very happy. And I'd close on that, Emmy.